So welcome everybody to today's spring injury prevention series. Today we're going to be talking about river safety. We're very fortunate to have two outstanding presenters. We've got Allie Evans from our own emergency department at the University of Utah. She's an educator within the department, and we're very excited to have Allie join us as always. She supports lots of events and adventures that we do within the department. And we also are really fortunate to have Karen Locke. She's the manager of the National Ability Center Whitewater Rafting Program. And again, we have such two highly competent people presenting today is really an honor. So thank you both for presenting. We have, as normal, as usual, we have no disclosures to make today on the 4th of May. Our next session will be, we've got two things coming up on May 18th for our spring series. We've got a very interesting conversation about skateboard and longboard safety. And probably all of us on this call have somehow experienced someone having an injury due to both of these very popular sports and adventurous outdoors experiences. So we'll have it on May 18th, same time, 11:30 to 12:30, presented by Thomas Zimmerman. So we're very excited. We may have another community presenter as well. On June 1st, we will have off-highway vehicle presentation with our own Jamie Troyer and Chris Holler from the Department of Parks and Rec. So that's coming up on June 1st. And June 1st will be our last one for this spring series. A couple things for May, it's National Trauma Awareness Month. The University of Utah is now one of 144 centers across the country that is a part of the Trauma Survivors Network. It offers just amazing local and national resources to our trauma survivors. So this website, traumasurvivorsnetwork.org, is where you can get a lot of information. There's some upcoming events on May 19th, which is National Trauma Survivors Day. May 20th is National Stop the Bleed. And so you can definitely see a lot on that website as well. We've also got EMS Week, which a lot of you are participants and providers, and May 16th to the 22nd is a week to honor all of our EMS providers. And then there's launching soon is the American Trauma Society and Trauma Survivors Network, which is that resource that's going to be coming up. An outstanding resource with lots of tips and tricks to stay safe. I'm going to introduce our first speaker. I'm actually going to introduce both of them and then let them kind of go to the next level once they speak. But Karen Locke is our first presenter. And again, she's the manager of the National Ability Center for Whitewater Rafting Program. And she is, Karen is the Southern Utah Adventure Program Manager. She's worked more than 13 years in an abundance of river adventures. I'm hoping one day to jump in with her because she sounds like such an expert and sounds really fun. She's an EMT basic and has taught swiftwater rescue for 4 years. So she's going to give us a great overview of water safety and just kind of what that entails. We've also got our Allie Evans, who is currently the nursing professional development practitioner for the University of Utah Emergency Department, and she's very involved in whitewater rafting program through the National Ability Center. So I'm going to stop sharing.
Thank you so much. Let me pull up my PowerPoint really quick. I'm really excited to be here. Thank you all for inviting me. All right. Let's see. All right. So as we go through my presentation, I did just want to say, if you have any questions, please throw them into the chat. I might have Allie help moderate that chat for me and ask me any questions. Awesome. As we go through, my presentation should be about 15-20 minutes, and we'll answer some questions at the end. Linda did a really great job of introducing me, so I don't really need to do it again, but I've been a rafting guide for about 13 years. And yeah, I've rafted all over the world and love it. It's gonna be my career forever. I started teaching swiftwater rescue about 4 years ago, and I have my own company called Confluence Rescue, and I specialize in teaching nonprofits and also scholarship-based, because I don't believe that rescue courses should be limited by price. And my presentation is not moving. Let's see what's going on. There we go. Raft Guide, now technologies. All right, here's my email. If anyone has any questions after this course, feel free to take down my email. I'm always available and I love answering questions about water. So when we start talking about water safety, we want to talk about accident avoidance, right? Not getting into those situations. And that really comes with good training, good knowledge, and good gear. So if you live and recreate around rivers, especially rivers that flood, it's really important, I think, to get some basic training. Swiftwater Rescue is a great course. There are different levels to it. You can search a course out through Googling it or going to the ACA website, and that is the American Canoe Association. Like I said, different levels of the courses. You can take a 1-day course or a 3-day course if you're really into it. And definitely with that training, of course, having practice and continuing to use that training. I think I took Swiftwater Rescue course about 3 times before I really understood what I was doing. When we talk about good knowledge, we are talking about not only your knowledge, but also the knowledge of those people around you. When I get on the river with new people, I really like to ask them some questions first. You know, are you a new kayaker? Are you an intermediate kayaker? Let's get some information so I can, like, if you're a beginner, I'm going to be watching you extra hard on the river. You also want to have good knowledge of the rivers you're going on. We often call this beta, so just beta on the river. If I'm going on a new river I've never been on before, I often ask people who have been on it recently for some information about the bigger rapids. I'll also ask them about, like, are there any trees in the water? Has it flooded recently? What should I watch out for? Getting good information. And all of this is happening before you even get on the river. Also, good gear. And when I talk about good gear, I'm not only talking about your gear, I'm talking about the people you're going on the river with, their gear. And that's because if you end up in a situation, they are going to be the ones rescuing you with their gear. So check it out, just get eyes on it before you go on the river. Make sure their throw bag is in good working order and that they know how to throw it, because again, they're going to be the ones rescuing you if you end up in a situation. So good gear. Have a little a little river safety kit here for you. The first 6 items are items that you should definitely have, and the last 5 are kind of additional gear that I like to bring on the rivers with me, but it's more optional. So number 1, you want to have a whistle. I like to have a whistle on my personal flotation device, and I keep it up by my shoulder, and I have it on a short little tether. We use the whistle for communication, and I like to have it on a tether because I can blow the whistle and I can turn my head at the same time. If it's short, you're only stuck in this one position while you're blowing your whistle, and it's really hard to look around. And then your personal flotation device, your PFD or your life jacket, some people call it. Really, really important that you like your PFD. That's number 1 for me. If you don't like your PFD, if you don't feel good in it, you're not going to wear it, and that's not going to do you any good. So number 1, try it out in the store, try out your friends, make sure you like it, make sure it fits nice and snug around your rib cage where it's supposed to fit tight. Also, living in the desert, I've realized that you really want to check it often for rips and tears and sun damage. The sun does a lot of things to our gear out here. And I used to live on the East Coast and gear lasted a long time. And then I came to the desert and my cloth gear lasts about like 3 years and I use it pretty often. So always checking your PFD for mildew, rips, tears, holes, things like that, and then rotating it out when you have to get a new one. A throw bag. Throw bag is a basic piece of gear that everyone should carry on the river if you're recreating out there. That is that yellow bag in this picture. And it is basically a bag full of some rope. It's what you use to reach people who are swimming in the water. It can be used for a couple other things also. They make different styles. They have the like handheld ones. They have the ones that go around your waist. I recommend trying out some different ones, borrowing your friend's gear, seeing what you like, and then making a purchase. It's always great with river gear to try it out, because once you get it and you're like, I can't throw this, 15-pound bag. It's got 80 feet of rope in it. It's good to know that before you put down the money for it. A few locking carabiners are great for the river. We don't want to use non-locking carabiners because those could attach to something that you don't want them to attach to. So always locking carabiners on the river. Always a knife. You can put it on the front of your PFD. You can put it into a pocket of a PFD. It doesn't matter as long as you can reach it in an emergency if you need to cut a rope or something. And then a helmet. Helmet's really important for some rivers, not so much if you're just like the tubing kind of person or like the float down a river. But if you're going on a river that's rocky, that has class 3 rapids and above, I would definitely suggest a helmet. Again, really important that you just like it so that you wear it. If you don't like it and you don't wear it, it's not doing you any good. And then some additional gear. So we're talking about some safety gear, and this is more after you get that Swiftwater rescue certification. You're like, I want to carry a little kit with me in a little dry bag. You're going to throw some tubular webbing in there, some pulleys, some static rope. I like to put pocket guides because in the event of an emergency and you're trying to figure out how to set up ropes and tie anchors and do all this stuff, like a little picture is great and no harm in like checking out the resource before you're actually doing something. And then I carry a little med kit and a CPR mask, and I also carry a CPR mask in my personal flotation device. And so that's why I like to have a pocket on my personal flotation device. Cool. All right, talking about the power of water. So swift water is technically any volume or velocity of moving water in which a person is unable to control his or her own movement. Swift water is powerful and relentless, but also predictable. So a lot of people tell me, hey, I'm really nervous around water. I don't understand it. And I equate it to folks who have avalanche training. They understand the snow and they can predict avalanches. The same once you get into the whitewater world and you get out on some rivers and you take some courses and you learn basics, you'll start to understand and predict whitewater more, just like those folks with avalanche training can really understand the snow and predict avalanches. Rivers are measured in CFS or cubic feet per second. Rivers run anywhere, a river you're gonna raft on, it's probably gonna be running somewhere between 2,000 CFS and about 40,000 CFS. So this is a cubic foot of water running down the river every second. 1 cubic foot of water is about 7.5 gallons, which weighs 62 pounds. It's absolutely incredible. This gives you a good idea of how powerful water is. In this picture here, this is on the Rogue River in Oregon. You can see how this boat has been pinned up against this rock. The only thing holding it there is water. And it looks like it's going to take a lot of ropes and pulleys to get that boat off of that rock. And that boat probably weighs about 1,000 pounds. So water is extremely powerful. And when I learned about CFS, my instructors always taught it to me as a basketball. Imagine 2,000 basketballs or 40,000 basketballs coming down the river every single second, and that's a cubic foot of water. The basketball for me was not intimidating enough, and so I like to relate it to fat chickens. So if you can imagine 40,000 fat chickens running down towards you every single second while you're on the river, that gives you the intimidation factor of what you should feel when you're on a river at that volume. Cool. All right, personal safety on the river. So when you guys get out onto the river, we're going to talk a little bit about wading, defensive swimmer position, entrapments, sieve strainers, and undercut rocks. In this photo here, you can see some folks wading across the river. Typically, we tell people on the river, you don't want to wade in above your knees with a personal flotation device on. You know, it really depends on the velocity of the river, how fast it's moving. But when you decide to wade across the river, you want to look at a couple of things. You want to determine like how fast the water is moving, the velocity, the depth of the water, how far am I going to be able to get out before I hit my waist and my PFD, because at that point you're not wading, you're just going to float and go downstream. You also want to check out your entry points and your exit points. So your exit point would be if you were wading and your feet got swept out from underneath of you, where are you going to be swimming to? If there's a bunch of tamarisk for the next mile, you're probably not getting out on that side of the river. Just be careful, always keeping your head on a swivel, looking around you. Where am I going to be swimming to? When people are wading, I love to have someone downstream. We call them downstream safety, and they're typically like 50 to 100 feet downstream, and they have a throw rope, and they are ready to throw that rope out to someone should they be wading and their feet come out from underneath of them and they have to swim downstream. And then we have the defensive swimmer position. So in this bottom illustration here, the B, you can see the defensive swimmer position. I like to call it the nose and toes method. Your butt is the lowest part of your body in the water, and your nose and toes are sticking out to the sky above you. This not only helps prevent face and neck injuries and chest injuries, impacts to rocks and things like that, but more importantly, it helps prevent foot entrapments, which is a really, really scary scenario. You can see in this top photo, this might be a little bit exaggerated, but that's good because it's really, really dangerous and really scary, is a foot entrapment. So you can imagine if you're swimming along in a river and you're trying to stand up, like there are old cars probably down there, there's trees down there, there's rocks with cracks in it, your foot could get stuck. And then remember those chickens, they're all coming at you at your back and they're gonna push you down. And that's not gonna be a good situation, but it's 100% preventable. If you were rafting and you fall out, you just want to assume this defensive swimmer position. And if you're raft guide or if you're kayaking, you want to get back to your kayak, you just roll onto your stomach, arms out in front of you, your feet are behind you, and you're swimming in the direction that you need to go, but your feet are never trying to stand up in the water. All right, and a little bit about body entrapments and sieves and strainers. So this is basically anything in the water that has cracks in it or has spaces in it where water can come through, but it might be too narrow for a kayak or for a raft or for a body. So this was taken in Washington on a river up there where a lot of people kayak. And you can see the guy in the red with the red helmet. He's in a kayak. You can just see the stern of it, the little blue spot there. And it looks like he went to go through these two rocks. It wasn't quite wide enough, or the front of his boat got stuck. He basically pinned his kayak in between these two rocks, and now he's stuck there. And it looks like his buddies, his rescuers are there, and they have a rope attached to him or a piece of webbing attached to him that he's probably holding onto to help keep his head up out of the water. And it looks like they're going to try to pull him back up. But these are very dangerous and very scary scenarios. Rocks don't look like much in the water, but personally, I swim away from every single rock and every single tree in the water because you don't know what's going on the face of that on the upstream side or in between it. There could be cracks, like I said, there could be trees stuck in there, there could be rebar. So when you're in the river, if you fall out, you're swimming, just swim away from those obstacles, those big rocks and those trees. Don't try to swim and grab a hold of them. It could end up in a bad situation. And scene awareness for river incidents. So we talked a little bit about safety prior to incidents, but a little bit of scene awareness for whitewater incidents once an incident happens. So vigilance is really important, keeping your head on a swivel for things going on around you. Things in the whitewater world within an incident happen really fast. If you have the team members with you, it's really nice to have some extra help. I like to always have someone, if there's someone stuck in the water, say this person, I like to send someone upstream, probably about 200 feet or wherever they can get to. There are upstream spotters. So they are stopping traffic. They're stopping other rafts or other kayakers from coming down. If it's flood stage, they're looking out for large trees floating down or debris. And then I like to have a downstream safety. So that's that person with a throw rope waiting. Like if this person they look like they're foot entrapped or body entrapped somehow. Let's say they lose consciousness and that their body becomes limp then, and that might help them get out from that entrapment scenario. Then they go floating downstream. So it's really nice to have at least 1 or 2 people downstream in case that happens, to go help that person. Task management is really hard on the river. Again, things happen super fast, but if you're, familiar with search and rescue teams, you have the officer in charge. That's always helpful to have that person, but it's not always going to happen. Again, things happen so quickly on the river, and your scene is moving a lot of times. Go slow to go fast is really, really important. You don't want to you don't want to try a shortcut and then, make the situation longer in the long run because you were running and you tripped and you fell on the slippery rocks or on the moss or things like that. Too frequently, a shortcut or a hurried decision by an individual team member jeopardizes the entire party or the rescue effort. So constantly, as things are happening in the whitewater world, within an incident, I just always repeat to myself, go slow to go fast. As you're going slow, you're more detail oriented, you're going to get it right the first time. And then preparing for contingencies with the PACE acronym. So it's primary plan, alternate plan, contingency, and emergency. This is 4 plans. You're probably not going to get all of them out there. This is just something that we like to keep in the back of our mind. So again, a downstream spotter is a great or downstream safety is a great emergency plan. If something were to happen, you have that catch-all at the bottom of the rapid. But just prepare for uncertainty. It's going to happen in the whitewater world. Trees are going to float down, debris is going to float down, something's going to be happening upstream of you, something's going to be happening downstream of you. You have to have a tolerance to it, and you have to be able to adapt to those situations also. So here's a good example of our downstream safety. Someone swimming through a rapid and someone just ready with a rope to grab them. And then you all are probably very familiar with this, but just to reiterate very quickly, when there is a river rescue scenario, you want to prioritize yourself also. Prioritize yourself. And then second is going to be your group. Third is going to be your patient that you're trying to rescue. And then fourth will be a victim or a body recovery. And then very last, your equipment. And then communication on the river. Hopefully y'all have seen Portlandia before and you can get a good laugh about this. But communication on the river is going to be difficult. If you are on a wide river like the Green River or the Colorado River, if there's any sort of rapid, you are not going to be able to hear anyone say anything. So that's where these whistles are really important. We use our whistles for a couple different communication aids. The first signal would be one long and loud whistle blast, and that basically means attention, and everyone looks to the person who is blowing their whistle, and they could be pointing at a person who's fell out of a raft, fell out of a kayak, they're swimming. It could be attention, there's a tree coming down, or a raft flipped upside down. It's attention. If you hear 3 long and loud whistle blasts, that's going to mean true emergency. So not that someone, a raft flipping over is an emergency, but 3 long whistle blasts is going to be someone's foot entrapped, someone's floating face down, they're not conscious, they're not turning over, things like that. It's going to be true emergency. And that's when you want to probably grab your med kit and your gear and get ready for an incident. So it's important, I should have said this before, whistle blast, but it's important to chat with your group. Again, good knowledge, going back to like, who are those people you're going on the river with? Go over these communication aids before you get on the river and make sure that they have whistles, make sure that you're all on the same page. The last thing I'm going to go over is hand signals on the river. So whistle blasts are great, but there's only so many things you can do with a whistle. So we're going to go over hand signals really quick, and I'm just going to show you. So I'm going to stop my share. All right. So for your hand signals, just going to go over a couple, and this is great to go over with your group. Hand up is going to be the first one. So you see my hand all the way up in the air. Yep, perfect. Hand up is going to be a question and a reply. So it's going to be asking, are you ready? And we use this if your group is separated and they're across the river, someone fill out their kayak and they have to drain it. You're going to ask them, are you ready? And they can raise up their hand also. You can also use a paddle as an extension. So holding up a paddle above your head will make it easier to see. Another question and response is going to be the question, are you okay? We use this so often on the river, and it's tapping the top of your head. So it's a question. I'm asking you, are you okay if I'm looking at you? And if you tap the top of your head back at me, you're letting me know I'm okay. If you don't tap the top of your head, I'm probably going to come get you a little bit faster than I normally would. Make sure that you're okay. But again, that's a question and a response. Stop is an important one. So if you are on an incident and you are at the top of the rapid, you are that upstream safety. Stop is going to be 2 fists high up in the air. You can also use a paddle, holding a paddle horizontally with your 2 fists. That's going to mean stop, don't go that direction. If you're pointing, if a guide or someone you're on a trip with is pointing, we always point positive. So we're saying, go in that direction. Go this way, come towards me. You never want to point towards things that are bad on the river. I know it's a hard habit to stop doing, but you never want to point to something and be like, whoa, that looks really bad. We always want to point positive, thinking positive. And then emergency. Emergency is going to be the arms above the head and an X. So again, so we use this for, are you okay? And then we also teach people, you know, if there's an emergency, you're gonna be blowing your whistle 3 times and you're gonna be putting this above your head. And this can mean med kit, emergency, come help. Yeah. Woohoo. Thanks, guys. Were there any were there any questions, Allie?
I don't see any questions in the chat.
Okay.
I have a question.
Right now.
Where can people go to find either current or existing information about the conditions of a river?
Yeah, AmericanWhitewater.org has river information, including rapids, the current CFS they're running at, and then it also has usually a comment section for each section of river. So if you're looking up like the Fisher Towers daily or like Cataract Canyon, there's comments. And so people, that's important to go through because people will say like, oh, I went through there last week and there's a tree stuck over here. This is going on. Or in the West here, we have rock falls all the time and it creates new rapids. So that's important.
Great. Thank you so much.
Yeah. Thank you. All right. I'm going to let Allie take over.
Okay, and if you guys think of any other questions, just throw them in the chat. We'll have time at the end too for more questions. Okay, thank you so much, Karen. That was great information about injury prevention. Now I'm going to talk a little bit about whitewater injuries in general, specifically related to trauma, and then I'm also going to discuss 2 case studies. So there are 4 main injury types when it comes to whitewater rafting. The first is direct trauma, and that's usually from striking an object. Indirect stress, which comes from the paddler's position or force of the water. Overuse injuries, and submersion environmental injuries. We are going to talk specifically about direct trauma and submersion. Direct trauma includes musculoskeletal injuries, soft tissue injuries, and blunt trauma. One recent study looked at the injury rate of 1 million commercial paddlers over a 5-year span on the New Rivers and the Gauley Rivers in West Virginia. These are very high volume rivers with large rapids. They calculated an injury rate of 20 per 100,000 commercial rafters and a fatality rate of 0.68, so less than 1 per 100,000. So the report also found that musculoskeletal injuries accounted for more than almost half of the injuries, and then soft tissue injuries came second. Common musculoskeletal injuries include sprains, strains, fractures, and shoulder dislocations. The shoulder dislocations are specifically related to abduction and external rotation during high bracing in that turbulent hydraulic water. So a good example of this would be the kayaker on the bottom left, that high brace where you're holding the paddle pretty high up and you have a really easy way to dislocate your shoulder. Musculoskeletal injuries also commonly occur when hiking around the river or just walking on the wet rocks. So keep that in mind when you're walking to and from your boat. Soft tissue injuries include lacerations and abrasions. And honestly, most if not all rafting sections in the state of Utah that require a permit to go on the section also require the group to have a first aid kit. So I'd recommend bringing this on all and any whitewater or flatwater excursions that you go on. And then your first aid kit should have basic supplies to help with these simple musculoskeletal and soft tissue injuries. But keep in mind that you should probably have one person on the trip who has medical knowledge and knows how to use the first aid kit. Going into blunt trauma, blunt injuries most commonly occur when participants are ejected from the raft and strike a hard object. For example, let's take a look at this picture up on the top right corner. This boat is most likely going to flip. You can see it's high siding, and the participants could be ejected into a rock. Someone else's helmet, like these guys in the green on the top, could hit the red person's helmet. The end of a paddle, a log in a river. I mean, the possibilities here are endless. So from this slip, you could have head injuries, contusions, broken ribs, and a lot of serious injuries. The injuries are going to need to be treated in a hospital. So keep in mind, most river sections in Utah, especially on the Green and the Colorado, they're very remote and you won't have cell service. So you might have to use a satellite phone to call for help. And then remember this, you're going to have a lengthy process to get a medical team there or to evacuate the person to a hospital. Submersion and environmental injuries include heat illness, dehydration, sunburn, insect bites, hypothermia, frostbite, and drowning. A lot of the prevention for these injuries starts with proper planning, like Karen went into. Another thing I want to mention is to always check the weather before your trip and prepare for all weather conditions. We all live in Utah or around Utah and know how fickle, especially the spring weather can be. So 1 minute it's 90 and sunny, the next minute it's 40 and sleeting. Just remember the saying, there's no such thing as bad weather, just bad gear. And then in addition to weather planning, be sure to layer appropriately. When it's super sunny and hot, make sure to wear that lightweight, breathable clothing to protect your skin from the sun. And then when it's cold, think wool and fleece. So those non-cotton, quick drying layers. And then always bring a change of dry clothing that's in a dry bag. So you know that you'll have that if you do get wet and cold. And then lastly, drink plenty of water. So try to get ahead of that dehydration. Are you hot and not sweating? Do you have dry lips? Is your urine really concentrated? Drink more water. And it's always a good idea to layer some electrolytes into your water. So, you know, when you're sweating, you're losing those electrolytes and then you're replacing them and not becoming hyponatremic, which is another thing to look out for when you're on the river. All right, so let's go ahead and talk about a few of these injuries more in depth through 2 case studies. These case studies are public case studies from Canyonlands National Park. And let's start with the first one. So this river incident unfortunately occurred in Cataract Canyon. I'm going to kind of read the briefing here from the website. A 32-year-old woman was one of 14 members in a group with 6 boats. 7 were experienced boatmen, but only 1 had previously navigated Cataract Canyon. The party had been warned of a cold front moving into the area, and on November 9th, the range of temperature in Moab was from 58 to 38 degrees. The temperature of the river in Cataract Canyon was 46 degrees. Some of the boatmen were equipped with wetsuits, but the woman was not. In addition, she did not know how to swim. The boats reached the head of the big drops at 1500. The raft in which the woman was the only passenger turned over in Big Drop 2, and she and the boatmen were in the water for 2 to 3 minutes before gaining the shore. By the time the boat was righted, the woman was given dry clothing and Big Drop 3 was scouted. It was dusk. The woman was now wearing a wool sweater, long sleeve turtleneck sweater, a down vest, jeans, socks, sneakers, and a life jacket. She declined a wool hat, saying she was not cold. The same boat flipped again in Big Drop 3, and the woman and the boatman clung to it while it drifted about a half a mile until it struck a rock 20 feet from shore. The woman was stripped from the raft and climbed onto the rock while the boatman swam ashore. While seeking a throw line, the boatman could hear her weakening calls for help. The woman slipped into the water and the boatman was unsuccessful in reaching her. The body was found about 30 minutes later, after dark, head out of the water, still in her life jacket. CPR was initiated and continued for more than 4 hours by a qualified EMT with negative results. So let's talk a little bit about this case. First and foremost, I want to remind you that this woman was ejected from the raft. So we really need to treat her as a trauma patient until proven otherwise. Like Karen discussed earlier, she may have hit something when she was thrown from the boat or when she was in the river. She also at one point slipped from a rock she was holding onto. So many opportunities here for trauma. A good way to approach your assessment once you reach someone who's been ejected is by going through your ABC survey, specifically airway, breathing, circulation, disability, and exposure and environment. The fact that this person is cold may be distracting you from thinking of a traumatic injury, but and keeping in mind, you may not be able to appropriately assess their mental status because of their body temperature. So remember, altered mental status could also be due to that traumatic head injury or traumatic spinal injury. The patient may also have a diminished pain response because of the cold. So the reaction to painful stimuli might not be the most helpful tool. The best thing to do here is to expose the patient completely, look for traumatic injuries, get them out of their wet clothing, get them warm, and then do those frequent 15-minute reassessments until you have something more substantial to go off of. Now I want to shift from this potential trauma patient to the fact that she was in really cold water. In 2006, an American Whitewater Association study suggested that the greatest risk of death in whitewater sports is asphyxia related to underwater entrapment against a solid object. However, in this case, the victim died from a flush drowning. Flush drowning is typically associated with high flows and large river volumes, which we do have in Utah. This complicates river efforts because of the vastness of the river. Flush drowning is also associated with proper PFD use and a lack of prolonged underwater entrapment. So victims of flush drowning are repeatedly submerged in this cold, turbulent water, which eventually leads to asphyxia. In this case, the woman had multiple immersions in cold water and air without proper gear. So just talking a little bit about cold water immersion syndrome, this is gonna first and foremost compromise the respiratory and autonomic physiological responses after that sudden immersion in cold water. And this doesn't have to be very cold. It could be as warm as 70 degrees Fahrenheit. So keeping in mind, in this case, the water was 46 degrees. And there are 4 stages. So cold shock being the first stage lasts about 5 minutes. It's this involuntary gasping, tachypnea, peripheral vasoconstriction, and then that eventually shunts that blood centrally. The second stage is swimming failure, and this happens within 30 minutes of water entry. Extremity cooling, hyperventilation induced tetany, and shivering thermogenesis contribute to this coordination loss. And then nerve conduction is also diminished as this tissue was cooled. So at this point, the swimmer doesn't have enough tactility to grab that throw rope or swim to shore. And it's a big problem at this point. So these first 2 stages, the cold shock and swimming failure, are the most commonly associated with flush drowning deaths. Moving into the third stage, hypothermia, or this core body temperature below 35 degrees. This occurs normally when a victim is immersed in water that is 41 degrees or less for 30 minutes. So most flush drowning victims are rescued prior to this stage. And then circumrescue collapse is essentially arrhythmias related to sudden heart cooling. So this also requires prolonged immersion in the water and most flush drowning victims are rescued prior to this stage. And just talking about injury prevention, in this case, in addition to everything that Karen mentioned earlier, the first thing that you want to do is get that victim out of the water, out of their wet clothing, and warm, ASAP. You can attempt rescue breathing and CPR if necessary. And I did want to mention that some people immediately want to go to completing the Heimlich maneuver, and this actually isn't recommended because the victim could regurgitate that water and then inhale it. And then as far as hypothermia goes, or this cold water immersion, make sure that you're wearing a wetsuit or a dry suit when the air and water temperatures are low. And then run all rapids early. So if you do need to initiate a recovery, you have daylight to do that. Talking about this second river incident, we're going to kind of move to a different type of trauma here. So I'm going to go ahead and read the case again. At 1745, a 21-year-old male was hiking in Dark Canyon with fellow passengers from a river trip. He decided to jump from a, oh, is there a question? He decided to jump from a rock into a pool of cloudy water, and when he did, he landed on his rump in 6 inches of water. The young man had been warned about jumping into unknown bodies of water and afterwards accepted full responsibility for the accident. EMTs in the group treated for shock and secured him to a backboard. 2 hours were required to carry the victim 1.5 miles to a camp at the mouth of Dark Canyon. Meanwhile, another boatman was dispatched to Hite to initiate a rescue. The Park Service ranger at Hite contacted a medical helicopter at 20:30, and the patient was evacuated at 2300. Officials in the hospital reported that the victim's injuries included a fractured pelvis and a compression fracture of one of the lumbar vertebrae. Again, let's talk about these injuries. First and foremost, treat this patient like a trauma patient. In our facility here at the University of Utah, traumatic paralysis is an automatic trauma 1. So this report noted that the patient had a pelvic fracture and a lumbar compression fracture. You should be thinking potential pelvic fracture in any patient who falls from significant height. If you assess the patient and their pelvis is unstable, go ahead and place a makeshift pelvic binder. And you can do this by using a towel and maybe a cam strap or any other materials to just kind of take that pelvis and close it back up. And then remember, a person can lose 4 to 6 liters of blood, venous blood in their pelvis. So this is a super scary injury and a patient can go south very quickly. And then although the report doesn't specify which type of shock this patient was in, I'd guess it was a spinal shock. And then this usually occurs immediately after this traumatic spinal injury and is more common in young men. So if you're on a trip and you are with a person that loses their reflexes and sensation after a traumatic injury, make sure to stabilize their spine into that neutral position and call for help. The injury prevention in this case is really simple. Follow instructions. So in addition to this following instructions, another thing that you can do is pay attention and assess your surroundings. If you want to jump into the water, make sure it's deep enough. Even with this assessment though, you may want to rethink jumping off a cliff. You could have an undercut cliff or an unstable bank that could give way. If it were me, I'd be very cautious to do any cliff jumping without that further assessment and even checking my resources before going on that trip. Also, keep in mind the length of time it took this patient to get help. After the injury occurred, a boatman had to row to the ranger station in Hite. That was 2.5 hours away, and that was the initiation of the rescue. At the same time, a crew hiked 1.5 miles with the patient on a backboard to the rescue area, and that took another 2 hours. And then if you don't, they use this backboard, but if you don't have a backboard, you could use a Paco pad or a table, and maybe even make a sea collar using rolled clothing and tape to kind of get that spine stable. But then even so, the patient eventually was evacuated in a helicopter, and that evacuation started 5 hours after the injury. and then it was flown to a trauma center. So a lot can happen with someone in an unstable trauma in 5 to 7 hours. When you're preparing for a river trip, make sure you've discussed this rescue plan, like Karen mentioned, with your trip mates in the event that someone gets hurt. So you're ready to go and you know what to do. And just to recap, environmental factors may mask traumatic injuries. So keep that in mind. Know the alternative uses for the gear that you have. Always have a rescue plan and a way to call for help. And then remember, the nearest trauma center is probably a long, long way away. All right. What questions do you have about injuries?
How many injuries, how many people do you see coming in generally? You know, I imagine it starts around this month, May, or, you know, the peak months being June, July, August, I would assume. How many people do you normally get transferred, and are they from, you know, far away where it's a trauma that's being transferred to the U, or is it any local rivers and water areas? Because I know there was a neighbor, someone in my neighborhood actually was on the Jordan River and had an injury.
Oh, yeah.
Yeah.
That's a great question. So I actually asked trauma services to kind of look this up for me and see if they had any data on boating injuries and, you know, to see how many specifically were boating versus rafting. And we don't have that kind of data. So over the past few years, it seems as though there are only 5 boating injuries that came to the U. So we're thinking that these injuries are probably going to their local hospitals, or they're not, the bad ones aren't making it here. And then as far as like the Jordan River Trail injury, sometimes these injuries are coded as the actual injury and not necessarily a boating accident or a rafting accident. So again, unfortunately, we don't have great data on that.
It just brought awareness to me of the ability of the water areas that people are using boating and they're rafting and kayaking and doing things in areas that, you know, we don't traditionally think of these big rivers. And yet there's the same types of safety protocol that you need to keep in place, like your gear and your helmet and all these things that people in local areas within the Salt Lake Valley, perhaps, it's like, oh, I'm going to go try this little river that I found within some. So it's important to think about that as well, I think, and something I'll take with me, you know, in interacting with people.
I do think a lot of people too around here in Salt Lake go on to the Weber River and the Provo River, and it's a good idea to kind of have some of these gear recommendations with you, even on these smaller rivers, because when the water is higher or after a recent rain, they could have all of these obstacles in the river too that you'd have to look out for. Karen, do you have anything else to say about that? Kind of the smaller rivers around Salt Lake?
Yeah, I was going to say that just from a search and rescue standpoint, that we typically get a lot more calls on high water years, just because of people kind of getting themselves into scenarios that they didn't really know that they were going to find themselves in. And there's, you know, the water's going to be colder on higher water years. You're also going to have more debris, higher waves, probably, so more boats and rafts flipping and people swimming for longer too. Low water, you really just have to worry about the wind.
And
I
think
had a
also,
question
go ahead.
I had a question for Allie, if that's okay.
Yeah.
Okay. Allie, what are your thoughts on backboards on the river, as far as backboarding someone, and 1, you know, going through a rapid, or 2, going through flat water, the pros and cons, or what you thought?
Do you mean backboarding them and then rafting with them? Or
Yeah.
I actually don't have specific data on that. Have you ever had someone who's been backboarded that you've rafted through?
No, I have not. It's just a discussion within the industry. Some people say that they would backboard someone if they were going through just ripples like class 1s or flat water. And some people are very much like, no, never, because any little thing can happen. And if that person goes into the water. So
Right. Yeah, I mean, I think that would be that would have to be something that you assess. In the case study that I reviewed, they were actually hiking with this person. So luckily they didn't have to deal with actually rafting them. But that is a good thing to bring up for the group here. So remember, if you're strapping somebody to a backboard and then putting them in the boat on the water, the last thing that you want to happen is have that backboard with the person fall into the water and then they drown because they're strapped to it. So I think the best thing, at least from my perspective, would be to stabilize their spine, but don't strap them to anything. So whether that means 2 people holding them, specifically in an area of the boat that maybe works the best so they're not moving around. I don't know, Karen, what do you think?
I think every situation is going to be different, honestly, for that. And I think, yeah, you made a really good point of having people hold on to that person in case there was a swim, they could then potentially swim after that person and help them out. And with that, I wanted to see if there were any instances where you would keep a PFD on, or would you always take it off?
Do you just mean when we're rescuing?
Oh, yeah, I mean for injuries.
Yeah.
Are there any injuries where you would keep a PFD on? No.
I think you would obviously expose them first to see what's underneath, but the PFD could be a great brace. You know, if you have someone with broken ribs or some kind of chest trauma, that is actually a good way to kind of keep it all together and hold it in and create that brace that's gonna make sure the patient isn't moving. So you could definitely put it back on. And then especially if you're gonna be rafting with them, you'd probably wanna put it on too. I think we've got some comments here in the chat. Doug says, a Paco pad on top of the backboard would work great for stabilization. Yeah, definitely. And then Pamela mentioned that the PFDs I'm thinking are pretty stiff. So any other comments from the group about that? Rescue and PFDs and backboards?
And Allie for stepping up and being here again and sharing your knowledge with everyone. This has been a really successful and fun program that we've been having for the last year. We're actually, Emily and Jamie, I think we've completed summer, fall, winter, and now just a couple more springs and we've completed a full year. So thank you all for participating today and coming in once again on a Tuesday midday, and we look forward to our future collaboration with our experts and with all of you who have attended this call. So we'll plan on seeing you next time on, I think it's May 18th. Yep, I think I said it was May 18th on the longboarding and skateboarding presentation. That should in itself be a very fascinating topic to listen to. So again, thank you very much. And please reach out to myself, Linda Sossenheimer, Emily Johnson, and or Jamie Troyer for any questions or comments.
Thank you so much, Karen and Allie. That was great.
Yeah.